There's a big difference in the field of neurological rehabilitation about how a therapist approaches the rehabilitation of a child. There's two perspectives. One is called, well, the way you call it is stimulation versus compensation, which is where you stimulate a child to develop instead of compensating for their condition through means of, say, things like wheelchairs and walking frames and these sorts of things. There's also another one, which is at what point and what level you treat a child. This is referred to as neurological versus chronological. Now, chronological age. How old is your child? 2, 4, 10 years of age? That's the chronological age your child has. Some parents, if their child was premature, will say it's 6 months old, but adjusted, it's 4 months old. Now, for a premature child, we go with their gestational age, which means how long gestation are they along. And then at a certain point, usually about a year, you just start to say their chronological age, which is the actual birth date. But, so first of all, chronological age, how old is your child? But the next one is neurological age. Now, very few people ever talk about this. Neurological age is, what is your child able to do? At what stage of development are they at? Are they at the age of a 3-month-old, which means they're starting to roll, they're making a little bit of sound, they're starting to smile back? That's about the age of 3 months. Are they at the age of a 6-month-old child, which means they're starting to crawl on their hands, they're on their stomach, they're probably rolling around, starting to blah, 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 smiling, grabbing things? It's a 6-month-old. 9-month-old, maybe they're crawling on their hands and knees. Some kids might be pulling to stand on furniture. Some of them are starting to babble a lot more. They'll tell you whole stories. Is your child a 18-month-old? They might be walking, might be saying some words. You're starting to use their hands a lot more. Is your child the age of a 2-year-old or a 3-year-old or a etc.? Usually we go up to about the age of a 6-year-old, because between 4 and 6, and by the age of 6, it then becomes just, is your child at the same age as its peers? Because beyond 6, at that point you can start to run, you can start to move a lot better. Now, neurological age. If you then look at your child's, let's take an example of a child who is 3 years old. Okay, we'll call it, Johnny for for originality. Now, little Johnny is 3 years old. When Johnny goes to the physical therapist, they say, all right, your child's 3. A 3-year-old should be able to sit up, feed itself, talk, and walk. And what happens is they go, okay, we'll put Johnny in a walker, we'll put Johnny in a stander, we'll put Johnny in a sitting chair, and we'll work on feeding. Amongst all these 4 things, these are chronologically what Johnny should be able to do. The thing is, though, is that Johnny is nowhere near that neurologically. Johnny is not able to really move yet. Johnny is kind of rolling, kind of making some sounds. Johnny has severe cerebral palsy. And what happens is the physical therapists are relating to him as chronologically 3. But neurologically, if you ask the parents, they'll say, he's about the age of a 3-month-old, ability-wise. So instead of treating Johnny as a 3-year-old for therapy, you need to treat him as a 3-month-old, which means you work on his ability to roll. You work on his ability to crawl. You work on his balance, his vision, his hearing, his tactility. You work on all the things that a 3-month-old needs. If you go beyond that, you're then actually doing Johnny a disservice. There's one element which is the social element. You expose Johnny to, if Johnny has a high and a good level of cognition, then you need to expose him to things at the age level of a 3-year-old, if he is capable for that. If not, you expose him to the level that he's capable of achieving and capable of absorbing. Neurologically, we need to go back to the beginning. Now, parents say, well, I'm not 100% sure what you mean. It's kind of like this. If your child was in primary school, and then you took it out of primary school and sent it straight to university, would the child be able to function? No, they wouldn't. There are steps you have to go through before you can go to the next level. Johnny is 3. He doesn't have proper motor control over his body. He doesn't have proper sensations and feeling. All the senses he has have not integrated yet because he doesn't move enough. So, sending him straight to university, which for Johnny is teaching him to walk, isn't fair because he's not going to be able to achieve that without assistance of a walker or a wheelchair or some sort of device or somebody's assistance. So let's go back and use the time that we have in therapy more effectively. Let's go back to the foundations where Johnny is. Get him to crawl on his stomach. Teach him to have coordinated control of his body. Get him to increase his body awareness and his balance. And when you work on these things, you're going to help him improve his motor coordination. Then he's going to start moving. Then we're going to get him on his hands and knees. We're going to start to integrate his movement and his balance and his vision all together. And then we're more likely to get Johnny to go from primary school to high school. Then eventually, hopefully, we'll get him to university. But we're not going to do him a disservice by going too far ahead. Now, we do not take the line of thinking of a law where some parents will say, oh, but it's cruel to have a child back on the floor. It's inhumane. It's not at all. It's actually inhumane to deny the child that ability or that option. We make it fun. We make it challenging and enjoyable. We don't make it cruel. We also don't stand children in standing frames for hours per day, because that is cruel in the sense that the child can actually develop very, very bad posture. We don't leave children in wheelchairs all the time, even when they go to school. Some schools will say, oh, we have a policy that we have to leave children in wheelchairs. Then don't go to that school. Go to another one. What happens is we need to challenge children at the level they are at so they can benefit. If we go too far ahead, they're not going to benefit. Now that's an example with cerebral palsy. Let's take an example of a child with Down syndrome. A child with Down syndrome, they have usually a decent ability to progress through the different levels of movement. The question is have they done it enough? Now, a child might be walking already by the time we see them, which is not ideal, but it does happen a lot. And so we'll take let's say a 3 or 4-year-old who's walking, but walking poorly, or talking, but poorly. We will still take them back and get them to work on that very foundational ability of crawling on the stomach, crawling on their hands and knees, so that when they get up to walking, it's going to be of better quality. Because really all their movement is integrated. They have greater body awareness. They have greater balance and fine-tuning of movement as a result of having done all of those steps better. And then thirdly, you might say a child who has a behavior problem or autism. Well, neurological versus chronological then takes into account movement as well, but it also takes into account sensory development. At what stage is a child's sensory development at? Their auditory functioning, their vision, their tactility. What is their ability for motor, which is speech and manual competence, as well as movement. And we can also add to that social development. Is a child feeding itself, toileting itself? How does it go with understanding the social environment? When we add all this together, we can start to develop a picture of chronological versus neurological. And no matter what the child's situation, it might be a learning disability, it might be a behaviour disorder, developmental delay, Down syndrome, numerous different conditions, we always go back to the neurological age. With children with learning disabilities, quite often they have issues that are based from the first 3 months of life. Neurological treatment means you go back and you treat that issue at that point of development where the child got stuck. So we're not going to work on how it holds a pen. We're not going to work on little tricks to help it remember better. No, we're going to go back and neurologically fix the problem at that neurological age. Maybe they need to work on a Moro reflex. Maybe they need to work on the asymmetrical tonic neck reflex, which is all things that happen in the first 3 months of their life. So that's neurological and chronological versus chronological age.
At times we see babies whose brain is fine and it's okay, but the baby may have had some problems at birth which are not connected to the brain, but something like hips, so that the baby's hips may have been dislocated due to a birth complication, and so therefore the doctors have to put the baby into plaster for sometimes as long as 3 months. And in the first 3 months of the baby's life, it is meant to do lots of push-ups and lots of rolling over. And because these babies are often put on their back in plaster, they are unable to do all the movements that babies in the first 3 months of their lives do. So then when they're taken out of plaster, they need to do catching up. But parents often are not aware of that, and they do not know that those first 3 months of movement with a baby on its tummy doing push-ups is very important. So therefore the child develops what appears to be normally, and then it goes to school, and the child has learning or vision problems. And so the parents quite often at that late stage call us up, and we check out the child neurologically, every little bit of it, and find that because in the first 3 months the baby's normal development was interfered with, therefore it does not give a strong enough foundation, and all the other neurological development is slightly impeded. And so the child is okay, but just not quite 100%. And we find that when we put those children back on the floor and let them do lots of push-ups and lots of rolling over and lots of all the movements that a baby does in the first 3 months of life, even though the child might be 7 years old by this stage, we let them do the movements of the first 3 months. And this really does help the child to catch up, because then the first levels of brain become strong with all that information, and then all the other levels of brain can then also develop normally.